So, hello everyone, and welcome to Dementia Unplugged Care Conversations. I'm Jeannie Forrest, and I'm hosting this program along with the support of the Dementia Society of America. And today we're talking about the role of spirituality and faith in dementia care. So, we thank you for being here. For those of you new to the program, we'll be talking with our guest for about 30 minutes, and then I'll open it up to question and answer. You can send your questions to the chat function. Please know that all of these programs are recorded, and you can listen to them again later on the Dementia Society of America's website. I want to just start out with this reminder that all content, including any potential medical information, is provided as an informational resource only and not to be used or relied on for any diagnostic or treatment process. It should not be used as a substitute for professional diagnosis, care, and treatment. Please consult your healthcare provider before making any healthcare decisions or for guidance about a specific medical condition. The opinions expressed and the content shared by Dr. Forrest, that's me, and her guests are not necessarily the opinions and content of the Dementia Society of America. Thanks for listening to that. I always like to start the program by giving an overview of what the word dementia actually means so that we all have sort of a common understanding. Think about the word dementia like an umbrella term. Like the word cancer, there are many different types of cancers. Like the word dementia, there are many different conditions that can present itself as a dementia. The most common, you may be familiar, are an Alzheimer's type of disease or vascular. You can have a mix of those, Lewy body, frontal temporal, and the list goes on and on. There are at least 200 plus different conditions that can present itself. It's important to know that dementia in and of itself is not a disease, it's a syndrome. Unfortunately, many of the conditions we don't have a cure at this point in time, but there are some conditions that can be reversed, such as having a vitamin deficiency or the result of hypothyroidism or an infection. But the majority that we often talk about here on this program are the progressive and unfortunately fatal conditions. So just wanted everyone to get a sense of the word dementia. Please know this is not a normal part of aging. And with that information, I also want to let you know that Dementia Unplugged has more than care conversations, and that's what we're doing now. But there's also two other programs. One's called Musical Connections. These are sessions with brain health scientists and performers, and they talk about the real benefits of personalized music. It's a monthly life enrichment program, and that happens on the third Monday of each month, and it's in partnership with a program called Music and Memory. Lastly, there's another Dementia Unplugged program called Artful Insights. This talks about particular pieces of art from leading museums. It's led on the fourth Monday of each month, and that's in partnership with Arts Philadelphia. So you can spend all of your Mondays being quite fulfilled, we hope. And now I want to introduce and give a little bit of a background of our guest, the Reverend Judith Watt, spiritual leader. She is now retired as a Presbyterian minister, and she served 25 years in 3 churches in the Chicagoland area. In 2019, she retired after serving 8 years as associate pastor for pastoral care at Fourth Presbyterian Church in Chicago. Before that, she was a solo pastor and head of staff at Presbyterian Church of Palatine. And her first call into ministry was to First Presbyterian Church of Evanston as an associate pastor. Again, all focused on pastoral care. She's married to her husband, David, a semi-retired CPA, accountant, and they live in Chicago along a beautiful Lake Michigan. So I am going to stop sharing these slides so that we can start the conversation. Well, hello, Judy. Welcome.
Hi, good morning, everybody. Judy, before you go on, I have a quick question. You can't hear all of the buzzing, can you, that's coming from my end?
No, I can't.
Okay, there's work going on outside of our high rise, and it's very loud, so I'm just checking.
Yes, thank you. Well, this is how live programs happen. Yes, I can never seem to predict when, at least in the summer, when they're going to cut the grass in the lawn next to it. So that's just the fun of this. So again, Judy, thank you so much for being here and for being willing to share your expertise and background and experience as a pastor. So maybe we can talk a little bit. Your faith tradition is, and I know some of this, but for the people listening, can you tell a little about the faith tradition and just to kind of get it started?
So my faith tradition is, as we talk about umbrella terms, it's a Christian, Protestant. Presbyterian is a denomination within the Christian faith, but also it's a Protestant form of, it's not Catholic. It's all a part of the Reformed families of faith. So I've been a Presbyterian for a good amount of time, but I grew up in another Protestant tradition, Methodist. So, but it's all pretty similar.
Okay.
Okay.
Good. So for the people listening, we know that this is sort of going to be the framework, knowing that there are many other faith traditions, but we wanted to at least start with this one. So again, so let's kind of delve right into that. Given the Christian sort of Presbyterian faith tradition, I'm going to start out with the question. I won't assume, but do you feel that faith has a role in dementia care?
Well, first of all, let me talk about the term faith.
Sure.
If as we talk about it today, I think I'll view it as faith being a belief in or an exposure to or a knowledge of a particular faith tradition within one of the major religions. So as opposed to a more general definition of I have faith in God, but I've not been exposed to a particular religious tradition. Is that okay?
Yeah, sure.
Yeah. So I'm going to define it that way. I think exposure to a religious tradition, whether it's Christian or Muslim or Jewish, as a child and maybe at other points in your life, I think it takes, even if you don't know it takes hold, I think it takes hold in a way. And so as I've seen people who have had dementia, various forms of dementia, if they were exposed as younger people or throughout their life to a faith tradition, they respond no matter at what stage of dementia they're in. They seem to respond to what they know of a faith tradition, whether it's scripture or hymns or certain communal prayers. And so in that way, do I think faith has a role in dementia? I think a person experiencing dementia benefits from having some of those traditions in their past. So I'm not sure that's the way you were asking the question, or if that's exactly what you meant, but that's how I've seen it.
Sure. And I have to say, from my experience as well, people, the longer embedded, longer term memories are what people and the brain holds on to for a longer period of time. And I think that speaks to what you're saying, especially if someone grows up from childhood and there's repetitive ways of practicing one's faith, that those particularly those prayers that have been said over and over again, for example, the Our Father, or hymns that have been sung over and over again, people hold on to those and can repeat that kind of prayer or hymn, even within second verses. Now, it may be that they're forgetting what they just had for breakfast or make very little rational sense in your conversation that you're having at the moment, but you can tap into that. And it's as if they're reliving it and they're present to that right away. So
I can give you a concrete example of that. When I was a seminary student, I did a field ed stint for 9 months at the Presbyterian Homes, which is a retirement facility in Evanston, Illinois. And so our training was focused on older adults. And on Sundays, we needed to take a worship service. We had a little cart with everything we needed to take a worship service to the three floors in healthcare. And the third floor was the memory care floor. So we would arrive there and through the course of the worship service, and people were in various stages of diminished memory. Some advanced stages and some just beginning, but those stages were enough to have them be on that third floor of memory care. So many of the participants looked as though they were sleeping, not paying attention, and maybe repeating themselves. But when we got to the hymns, or when we got to the Lord's Prayer, heads popped up and there was participation almost across the board. So it was a real visual of what that all meant. And I've seen that over and over again. And then on a one-to-one basis, taking communion to somebody on a one-to-one basis, or reading a piece of scripture to someone alone, there was a felt sense that person was taking that in a different way than they were taking in some of what you just talked about. What did you have for breakfast or whatever? Now, could they expound, give it back to me, or expound about what that meant to them? Maybe not. But there was a reception that was really obvious.
And so part of this conversation is not only the person experiencing various forms of dementia, but their care partners, their caregivers. And often on the call, we have many family members who are caregivers. Can you speak to the role of faith, or spirituality, and the impact it may have on those providing the care?
Well, I can think of all sorts of different situations, because what I know is that a family member caregiver, let's say it's a spouse, might have the same exposure to faith.
Mm-hmm.
A family member caregiver, an adult child, may or may not have the same belief structure.
Mm-hmm.
So I think there's all kinds of different scenarios there. I think in our better moments, if we are people of faith and have a trust in God, in our better moments through a crisis, we can, despite all of our sadness and struggle over what's happening to our loved one, we can kind of at least grab onto a sense that there's a plan here, or that God is present with us, or that God is present with our loved one somehow in ways that we can't see. So that doesn't mean that we don't struggle with it, or that we don't have bad days, or that we don't have times of tremendous doubt. But I think a level of trust in however you view the divine, and a level of trust in the presence of the divine in the situation can be grounding.
Mm.
I think that also there are times in a crisis like this, an ongoing crisis that really affects the family. There are those times you ask those questions. How can a God who is all loving and all powerful and all present let this happen? Mm-hmm. And I think that those questions, even those questions coming into our minds, can move us along in our own faith life. So so even though those are questions of struggle, I think there are ways in which we can grab on to our own personal struggle with God and what that means in our own lives. So, and I've seen caregivers who aren't family members, who are deeply spiritual, religious people. Now, they're not connected in the same way as a family member, but those people I have seen bringing tremendous trust and joy to the family and to the person who experiences dementia. So that's not to say that I think people who haven't grown up in a religious tradition are lesser caregivers. I don't think that's necessarily true. But I think it's helpful to believe I think it's helpful to have some kind of trust in a force beyond ourselves. So if you aren't in a particular religious tradition, I still think that's helpful and helpful to the person too. For a family caregiver, I think it's a good idea to think about their loved one and to think about what they've been exposed to, and to try to tap into that in terms of religious faith. Or just if you have a loved one who wasn't part of a religious faith, but who has a deep experience and valuing of the wonder of the world, I think it's also important to tap into that.
I think that's important for people to hear, and this might relate to the question I can maybe anticipate: is there, or how would you describe the difference between being spiritual and a faith? Do you see a difference, or how can we describe if there is a difference? So that I'm going to anticipate a potential question. So can you speak to that?
Well, I think that's a tough question. And I think a lot of people these days are saying, well, I'm not religious, but I'm spiritual.
Mm-hmm.
So I think that, and I've known people who would say that, I've known people who have said that, who are better Christians than some people I've known who are Christians. Okay, so there's that disclaimer. But I also know that it's a little bit diffuse, that definition. Spirit, it's amorphous, or it's sometimes we wonder what somebody means by that. Do they mean that they trust in God? Maybe. Do they mean that they think there's a force beyond us and they think all religion is bad? Sometimes. So, I don't know how to answer that exactly. I do know that the religious tradition, no matter where you are in your reliance on your own religious tradition of the past, there's something about that structure and grounding that is a little bit, I don't mean easier to tap into there's something about that structure that is helpful to tap into if you are a person who was in a religious tradition. I don't know if that made any sense to anybody.
I think it does make sense, and it also makes sense physiologically from just a sort of in terms of neurology and the way our brains are wired because it's those repetitive experiences that we build up sort of this working memory. So on that level, just a organic physiologic level, one could explain that connection. On the other hand, and full disclaimer, I believe there is a spiritual core to all of us that can be tapped into as the dementia progresses. So, the way I often talk with my clients is you move from this hypercognitive state where everything is rational and we're communicating on a very rational, argumentative kind of way of thinking. And then when that changes, because the brain is changing, you move to more of the emotional and sensory. And I believe there's a spiritual core to all of us that never changes, that can always be tapped into. So that, that's sort of my perspective on this as well. And maybe we're kind of saying the same thing, but people can see perhaps just in nature and seeing something greater than themselves by looking at a sunrise or something.
Absolutely. Right.
Okay.
To tap into that, I think, is important.
Yeah. So maybe you could talk a little, maybe just give us a few more examples, if you can, and of how one's faith has maybe changed, or as the dementia progresses, meaning, does it become more important as one recognizes that they have a life-limiting condition? Do you see that kind of phenomenon where people realize, well, this, I've been told I have this terminal illness, basically. Where do you see the role of faith at this point?
Well, when people are aware and first told about any kind of crisis, I think it pushes at the deepest levels of questions that we might have about if there is a God, who God is, what that means for me. And I think for some people, there's a tremendous reaching out to their faith tradition and to God. For some other people, there's a tremendous anger about it. Anger may be focused on God, which sometimes it bothers the family members or people around. But it doesn't bother me really. I think it's a normal thing to react with anger. And I still think behind those questions, I think God is pushing those. I think that the community of friends and family can be extremely important to a person experiencing dementia. And I think, in a faith tradition, as in a worshiping tradition, there is community that's part of that. And then there's our communities of family and all of that. I think community being present in some way is really important to a person who's experiencing this. So, and the assurance, whether the person experiencing the crisis or not believes this, the statement in some way that somebody else is there for them. I think that's and that, that if the door opens to talk about God, to be able to talk about what we believe, and that to assure somebody that God is present. But, we all know that at the wrong time, that message delivered at the wrong time can be kind of patronizing. Yeah. So,
Sure.
There are people that have, well, I'll tell you a story. This has nothing to do with faith, really, but I think it has nothing to do with faith, but it does have to do with community. And I think community is part of the way that we form community and are friends to one another and present to people is something that is a gift of God. So, and I don't want to dismiss that sense of community interaction around a person who has dementia. I have an aunt who died some years ago, but she had dementia, and I went to visit her. She was in a facility, but close to her sons, and they lived close by, and she just was repeating herself over and over again. Because I was visiting, the sons came to pick her up. We took her to one of the sons' homes, and several of us were all sitting around, and my aunt was there too, and we were talking about old memories. My parents who had died before her we talked about things that they did, and we talked about other family members. And during this hour and a half, my aunt became more and more lucid. And it just was fascinating to me because she was surrounded by people she knew and people. And so, no, we weren't talking about faith, but I think it was a spiritual thing that was happening.
Yeah. Yeah.
So, and so in, whatever faith a family caregiver has, I think that's important to express, and also to, even if you are at a different place than your loved one, faith-wise, to kind of try to pay attention to what you know of that person's faith before they got dementia.
Yeah. Good point. Wow, time seems to fly here. So I'm going to start asking listeners to send in their questions, and I see a couple here. So let me. So far, great info. Is a comment. Oh, here we go. do you offer or dementia care during your church services and to other individuals in the community before placement? So let me read that again. Do you offer dementia care during your church services and to other individuals in the community before placement? Well, I know Judy's retired, but do you know of, or did your previous places that you worked do this kind of care?
Well, during church services, I am not aware of specific parts of those services that were aimed at offering dementia care. I was aware of services in the church that dealt with people family members and families who are experiencing that crisis. Stephen ministers dealing with somebody on a one-to-one basis as the spouse had frontal lobe dementia. So there's services that I think have been offered, but during the worship services, no, I'm not aware of that. And then before placement, I think everybody struggles about placement. And
sure.
So people like you, Jeannie, are important in that process. And hopefully to educate pastors and people in churches about it is really important, so that pastors and church people and rabbis can refer and connect people up.
Yeah.
So.
And there's another facet to this that I just thought about. When I would be in care communities, and they would bring in pastoral staff to provide, mass or service. What I found is that the pastors often had very limited knowledge of how the mechanics of how to perform, or they would do the full-blown service with a group of people with very short-term memory, and by the hour, people were slumped over in their wheelchairs because there was no connection. And then I think there could be a benefit, and I know that there are other programs who do this, but to teach ministers how to keep it short, sweet.
Absolutely.
I was at a place where it was all Protestant, for the most part, members or residents, but they were playing hymns from a Catholic tradition, certainly Christian, but no one could relate to the music. And so I said, can you switch to something more familiar? And you're right. Everyone perked up and sang second and third verses. So I think it has to be tailor-made.
And concrete.
Very concrete. Yes. It can't be very abstract and you're just going to lose people. But
and the other challenge is that a lot of people, not just pastors, a lot of people in general think that because somebody has lost memory, that those people aren't responding to human connection. I think people, all of us are so narcissistic that when somebody can't respond to us, we think we don't realize that what we're offering them is something that's meaningful to them, even though they can't respond, or it looks as though they can't take it in. So I think people of all kinds need to be educated about that.
Absolutely. And it also addresses the sense of isolation that can happen with people with dementia. Often their friends, other family members don't come to visit. They don't know how, so they're afraid. I mean, there's all sorts of issues underlying that. And to have a faith community to intentionally visit is, I think, a beautiful religious God thing. So that speaks to your when you talk about community.
Yeah, and we had church members who would visit people with dementia, and they often wondered, what should I do? How should I be there? And so we did some training about that.
Mm-hmm.
So, which included some of the things I talked about earlier, but also going through family photo albums and that type of thing, and believing that their presence made a difference, whether or not their presence made a difference, whether or not they were talking about God.
Yes.
That
Yes.
God was there anyway. So.
Yeah, that act of being present. You know, I often say it's not so much what you say, the fact that you're there and value, showing that you value this moment means, it says a lot, means a lot. It's absorbed and felt a lot. That may not be able to be described by the person with dementia, but they know you're there. Absolutely. Is there any last thing you want to make sure the people who are listening, any last comment that you think would be really important for people to know from this conversation? Oh.
It's a chat.
Oh, okay. Sorry. This popped up at the same time I was talking. Our day program would be visited by many ministers. An Episcopal minister would have a discussion about his upcoming sermon with our participants, beginning and ending with prayer. Well, that's beautiful. That's beautiful. So I'm glad to see that others have, from whatever church or faith tradition, have a particular program. That's great. That's more concrete. Wonderful. Mm-hmm. That'd be nice if it could be replicated. So I don't see other questions. So my thought to you is, or my question to you, is there any last sort of parting words you would just like the listeners to hear?
You asked, one of the questions you asked maybe on paper was, were there any spiritual gifts to be learned from dementia? And some of them I've alluded to. At the risk of oversimplifying that answer, I think that having to grapple with certain questions about God is, as uncomfortable as that may be, and certain feelings and wonderings, I think that's a gift to have to struggle with that, if that's something that comes into somebody's life, that kind of question. But also, I think being able to be present and look for the small miracles when you're present with the loved one, very small miracles. I think that's like if a person with dementia who doesn't respond to much, just at some point in time reaches out a hand, or gains a look of recognition, I think that's a small miracle. And to be able to see that and appreciate it is important. We've talked about that a little bit in terms of calling it practicing the presence. There's a book by Brother Lawrence called Practicing the Presence, but it's practicing the presence of God no matter what you're doing, whether it's washing dishes or whatever. So I think looking for those small miracles is a gift that can come from dementia, and then to just realize that no matter how the mind is working, that, as you said earlier, Jeannie, there's a soul there, and the soul and the spirit is receiving things in ways that we maybe from God, but also from us. So it reminds me of when my mother was dying in her last several hours, and she did not have dementia, but she was dying from cancer, but she was not cognitively aware. And I remember a nurse saying to me in the hallway, she can hear you. So, and it was like, it woke me up. I thought, oh, maybe, oh. So I think what she meant was her spirit can hear me. So, and can hear what we say. So, and I believe that.
Mm-hmm. Mm-hmm. Thank you. So there are gifts that people can hear and receive. Um, there is one other question and popping up here. Have you experienced an individual living with dementia who previously was not spiritual or religious become more spiritually aware or awake? Want to become in touch with their higher power after a diagnosis? Good question.
Personally, I'm trying to think. No, I think that no, I haven't experienced the person diagnosed with dementia in those stages expressing that. I think that could happen. I've experienced the spouses of those people grasping on to somebody else who would, like a spiritual mentor or a guide or a Stephen minister or a pastor, grasping on to those people to kind of get through the situation and for hope, I think, to have a word of hope as they were going through that. So, and I think that changed the person's, certainly made the person more aware of his or her own faith. I'm sorry, though, I haven't experienced that with an individual just diagnosed with dementia.
Sure. Okay. Thank you, though. And this is from your experience, so absolutely. Doesn't mean it can't happen. It's just that.
Right.
Yes, absolutely. Good. Well, we have really, it feels like this is just the beginning. We could go on, but I think this speaks to, and I think I could share this, our belief that the faith tradition and spiritual point of view can be very integral to this journey, one's faith journey or just the dementia journey in and of itself. So now I'm hoping a miracle happens, and I'm going to switch the screen to be able to move over to the slides, because every time I do this, something seems to fun and happen. So hang in there, everyone.
And thank you, Jeannie, for asking me to do this.
Well, I just have to thank you for your time, sharing, this big part of your life, and with other people who are listening who may be going through this at this point in time. All right. So, and actually share. Yay. I do believe in miracles. Here we go. So we did the conversation. We did our questions. So again, as we thank Reverend Judith Watt for sharing her time and experience, I also want to thank the Dementia Society of America for sponsoring this program. If any of you are new to DSA, please take a look at the website. It's always being updated and changed and improved. It is just chock full of resources and information for caregivers. And if able, please consider donating to support this work. And I'll stop sharing one more time, and there we are. So for all the listeners, thank you. For those of you who sent in comments, thank you. And look for the recorded version if you'd like to hear this again or share with your friends and colleagues. All right, Judy, take good care.
Thank you so much.
Everyone. See you next time. Bye.